Hi, everybody. I wanted to welcome everyone to another episode of the JPN podcast. We're grateful to have Rabbi Steinmetz, the Rabbi of Kehillas Berchos Shmuel of the Albert Einstein Synagogue, with us this evening. Rabbi Steinmetz has lectured widely on topics that intersect medical practice and halacha, and we've been enjoying Rabbi Steinmetz's published classes that can be found in YU Torah for a while now, and I'm sure you will enjoy this talk this evening. Tonight's talk is titled Costumes and Care, a Clinician's Guide to Megillah and Medicine, where we will explore holiday reminders and common perm questions that doctors, nurses, and other medical staff deal with year to year. Without further ado, here's Rabbi Stein.
Thank you for the introduction. I am I'm more than happy to do this. I think this is, as I mentioned last time, this is just a really great organization that has such a great mission. So I'm happy to be a part of it. Okay, the way the talk tonight is going to go is I'm going to discuss different halachic quandaries that come up for clinicians in the hospital on Purim, whether that be the night or during the day. It's going to be based off questions I have received over the last number of years. That's kind of how I built, as I did in the last talks we've had also, but that's how I built the direction of the shiur. So we're going to begin really discussing probably the most prominent question, which is the question of Megillah. There are different aspects of that question, but the basic formulation is I'm in the hospital on Purim, whether that be the night or during the day. What do I do about listening or reading the Megillah? So the short answer is that if it's possible, the ideal thing is to get a cloth where you have a kosher Megillah, and you either, if you know how to read it, so you read it by yourself, or if you don't, so you put it in headphones and you try to listen to someone and read with them in order to be yotzei your mitzvah. That's again the very short way of the short ideal way of accomplishing the mitzvah. Now that runs into a few halachic issues, which we're going to begin discussing, and that's really how we're going to start. So we're going to start with the following. So the question is whether one is allowed even to read the Megillah when it's not in a public format, when it's not with 10 men, for example. So the Gemara Megillah Daf Hey Amud Aleph I put here on the slide, right? Amarav Megillah Bizman Akor Nosa Afilu Biyachid. That when you're reading the Megillah at the right time, so for example, this year, you're reading it on a Sunday, so if you're, or Motzei Shabbos, so when you read it, even if a one person, even a singular person, it doesn't have to be a minyan. Just to skip a few words, Rav Asi disagrees. So Rav says you can read, you don't have to have a minyan of people to read the Megillah. Rav Asi says you always need to have 10 men to read the Megillah. Hava Ovda concludes the Gemara. There was a story. And Rav decided to do like Rav Asi. He decided to be machmir, and he went make sure that there were 10 people around before leading the Megillah. Okay, so the Rishon already tried figuring out what's the halacha. So the Tur in Siman Taf Reish Pei Tes brings down a machlokas between Rabbeinu Tam and Rabbeinu Amram. And Rabbeinu Tam holds like Rav, which is Lakula, which says you can even read the Megillah as one person, as two people, as three people, doesn't need to be 10 people. Rav Amram holds that you need 10 people, like Rav Asi. We paskin like Rabbeinu Tam, who paskins like Rav, who says even a singular person can be mekayim his mitzvah, can fulfill his mitzvah by reading the Megillah. Now, obviously, ideally, one should search out for a 10 people at least. Barov hadras melach, the more the merrier. That is the better format of the mitzvah. Nevertheless, you would still be able to fulfill your mitzvah if you just had one or two people. That would not be a problem. Now, even though that is how we paskin, there is another machlokas in the Rishonim as to whether if someone is reading the Megillah himself as a singular person, whether he needs to make a bracha or not. The Mordechai says in Siman Taf Shin Pei Beis in Megillah says you do not make a bracha, but we paskin like the Maharam Yeroenberg out of the Beis Yosef, the Rama, they all paskin that even as a singular person, you would make a bracha. So practically speaking, if someone, you had a clinician working in the hospital on Purim night or Purim day, if they had a kosher Megillah, and they knew how to read the Megillah, or they were able to put it in headphones and read along, they would be able to make the bracha themselves to be yotzei the mitzvah. That's what comes out of this. Now, the second thing we kind of have to figure out is even though we just said that you're able to make the bracha beforehand, But the Rama I put here in Siman Tafresh Tzadi Beis and Siv Beis says Ein levarich acharei lebitzibor. So we know before we read the Megillah, we make 3 brachos beforehand, and we also make 1 bracha afterwards. The 1 bracha afterwards is the bracha of Haravis Rivenu Adanas Dinenu, that longer bracha. So the Rama explains, based off earlier sources, but the Rama paskins that we only make that bracha when there's a tzibur, when there are 10 men. So if you were reading alone in the hospital, you would not make the bracha afterwards. Now, why that's true is not so clear. Either it's because, as Chacham Avadia explains, that's kind of how this whole bracha is just a minhag at the end anyway, and it was developed that it was only meant to be said b'tzibur. Rav Shechter has in his Sefer Bikvei Atzon, the reason why you don't say it when you're reading as a singular person or less than 10 people is because, it's the idea is it's a bracha of a Talmud Torah derabim. So, for example, when you get an aliyah, so you make a bracha beforehand and afterwards. But if you were just learning yourself, you wouldn't make a bracha afterwards, even though we make a bracha in the morning beforehand. Because there's a special bracha that when you have Talmud Torah derabim, when you're teaching Torah in a public format, so you would make a bracha at the end. Either way, what comes out practically is, again, this clinician in the hospital is only going to make a bracha or the brachos beforehand, but not a bracha afterwards. Now, what happens if the clinician comes and tells you, okay, I'm happy to do that, but I don't have 35, 40 minutes to read the Megillah. I only have a 10-minute break here and a 10-minute break there. Or I'm not sure if I'll be able to get through the whole Megillah. I can start reading, but chances are I'm going to get called in 15 minutes. What should I do then? So the Shulchan Aruch paskins based off the Mishnah, Megillah and Daf Yud Zayin, and the Gemara and Yud Ches, that Kara Seirugin, that if you read Seirugin, what's Seirugin? Dahainu shepasak ba v'shaha ach v'achar kach chazer l'makam shepasak. You read, and then you stopped reading, and you waited a certain amount, and then you continued on reading. Afilu shakdei ligmar es kula yatsa. Even if you waited enough to finish the entire Megillah, you would still be yotze your mitzvah, meaning you're able to read in spurts, and obviously you can still make the bracha if you do it beforehand. It says the Rama, even if you spoke in between, it doesn't make a difference. Again, you're still able to read in spurts. It doesn't have to be consistent. You're not supposed to, but you would be totally able to be yotze your mitzvah if you did it that way. Now, the Mishnah Berurah here, I put on the source in Sifkat on Yud Ches, writes that this is true. However, the reason why you stopped reading and you had to read in spurts is because there was an onus, there was something out of your hand. So then you would have to return to the beginning of the Megillah. So if you start reading the Megillah and then an onus happens, something out of your control, so I don't know, suddenly you just need to go to the bathroom out of nowhere, or suddenly, something comes into your house, you have to change rooms and you just have to wait and you have to move room and it's going to take a little bit. So in that case, you would have to go all the way back to the beginning. Says the Mishnah Berurah at the very end, however, if you were stopped because of an onus, something out of your hand, you wouldn't make a second bracha, you would just have to begin all the way from the beginning of the Megillah. So the question is, when you're a doctor and you're on call, and there are 2 options. Either you have a 10-minute break and you're going to have to go back in 10 minutes, or you may have an hour break, but there's a chance you got called in 20 minutes in. Either of those cases, what kind of breaking is that? Is that a regular case of Kara Seirugin, and that you're just reading it in spurts? Or is it a case of, no, the only reason you broke and you waited is because there's an onus. It's something out of your control. So the Mishnah Berurah already points to his comment back in Hilchos Kriya Shema. I put in the source in Siman Samachay and Sivkat and Hey, where there the Shulchan Aruch is talking about Kriya Shema. So if someone's saying Kriya Shema and then they have to stop for some reason, so they stop and then they continue reading. They stop and they continue reading. However, says the Shulchan Aruch and the Rama paskins this way: if you stop because of an onus, you have to return back to the beginning. So says the Mishnah Berurah here, just to read it quickly. Tamam de bishlama im lo haya onos shem haya rotze haya yachol likros. Right? If there's no onus, so theoretically, if the person wanted to, he would continue reading. So that's lo havishtika. That's not considered as if you stopped. Vafila dibur hefsek. Aval ba'anos chashiva ashia hefsek. But when there's something out of your control, we consider that break in between when you're reading. That's a real block. That's a real hefsek. Kiven shelo ya'az yachol likros, because you weren't able to read. The thing that happened that was out of your control, you just weren't able to do anything. So he says, according to the Magen Avraham, that's dafka ma'ones u'machmas shahaish eno roi. That's only if the person can't physically do anything. Kigon shehutzrach lenekavav. So for example, if the person needs to go to the bathroom, or it's not a clean place to read, again, here we're talking about Kriya Shema. So there, in that case, the reason he had to stop was because of an ones, and it's too bad he has to go back to the beginning, because he couldn't literally read the Kriya Shema during that time. Aval ones acher, but a different type of ones could go machmas listim. Let's say out of nowhere you were attacked by robbers. So that's kimosha shasak. That's as if you were just quiet and you were doing it on purpose, and therefore it's not really hefsek, and you can continue reading. So again, what's important practically is the Mishnah Berurah is breaking up different types of breaks in your Kriya Shema, and as it applies to Megillah also. Again, if it's a regular break, you were in the middle of something and then you had to stop for whatever reason, so you can come back and continue where you left off. If it's because of an ones, you have to go back to the beginning. Now, what's an ones? So the Mishnah Berurah says there are different types. Some onsin, some types of ones are because, again, something just happened, you had to go to the bathroom out of nowhere. So you can continue where you stopped. But others are if you others, I mean, it's opposite, right? Again, if it's that one that you have to go to the bathroom, so you have to go all the way back to the beginning. But other onus, like robbers came out of nowhere, so that was as if you wanted to stop. It wasn't as if, right? Theoretically, you could have continued reading if you wanted to, but you weren't able to. So what exactly is the doctor? So it's not so clear. There probably room to say both. Ideally, you should try to lane the Megillah all at once. If that doesn't work, at least you should try to make the breaks in between the readings as short as possible. So if it's shorter than, 40, 45 minutes, 40 minutes, let's say, the time it takes to read the Megillah, that would also be totally fine. Now, if there's a break of, an hour and a half, so you may run into an issue whether you would have to go all the way back to the beginning or not. It's not so clear. Again, as I've expressed in other shiurim, it's a question that you should ask. How long do the breaks have to be for the specific situation? There's also a difference between someone who's on call, who's taking a break, but they're just on call. So theoretically, their break can be 2 hours. They just don't know. Versus someone that knows it's only 10 minutes. They know in 10 minutes they have to go back to their patients. And then there's also a difference between someone who knows that they have to go back to their patients just to do rounds versus someone who there may be an emergency. Because if it's just rounds, then theoretically you could have continued reading. So maybe that wouldn't be such a big deal if you stopped and you can come back. But if it's someone who has an acute issue that you would have to deal with, that may be an onus that you would have to go all the way back to the beginning, and you couldn't really read through if you really wanted to. So again, these are questions about this concept of kara serugan, about reading in spurts that in general we would say you're allowed to do it. If it's an onus, you're not allowed to do it. Specifically, if it's an onus that's like going to the bathroom, that you wouldn't have the ability to read through, then you presumably would not be able to do it. There's an interesting question that I saw in the Sefer Torah Sayoledes, which is a sefer that was printed with a lot of psakim of Rab Zilberstein in Israel, and many others. And it discusses, pregnant women kind of as they get closer to birth, all the halachos that have to do with that. So there they write this question of what happens if someone was in the middle of reading the Megillah, and in shul someone fainted, and they needed someone to bring them to the hospital. So the person that brought them to the hospital, what's his story? Is he allowed to continue from where he left off? He left in the middle of the Megillah, or does he have to make another bracha again? So he deals with that, and he quotes from Rav Elyashiv, again, assuming the break was short, so he would make another bracha as he continued, though. He wouldn't go back to the beginning. He would continue from where he was, but then he would make another bracha. A very, very interesting psak. Again, you can look at it's the end of that Sefer Torah Sayoledes. So that may have some ramifications to our case. But again, these are just kind of ideas that people should have in the back of their minds, that if it's a possibility, these are questions that are important to ask. Okay, so that's number 2. Now number 3. This is what we discussed again. Ideally, a person would have ideally, I should really go back and say, ideally, try to get a minyan in the hospital. Many hospitals have chaplains. There was just a resident yesterday who was telling me that, their chaplain in their hospital reached out to see if anyone needs to lane, and hopefully they'll get a minyan, and that will obviously be ideal. We're only talking about a case when you can't. So then ideally have your own Megillah with a kosher Megillah with a cloth and read it yourself. If you need to read in spurts, so again, those are the things that we just said. Now, there is an important distinction between men and women, and that's really the following. The Shulchan Aruch writes, this is in Tafresh Pei Test and Siv Beis, that anyone who reads or listens is Yotze their mitzvah, as long as you listen from someone who's chayiv in their kriya. So therefore, if you have a cheresh, a katan, or a shota, so you're not Yotze, because they're not Yotze themselves. V'yesh omrim, says the Shulchan Aruch, she'anashim einam motzios es ha'anashim, that women can't be motzi men. This line of the Mechaber comes from the Shita of the Bahag. There's a big machlokus in the Rishonim that we know women are chayiv in the mitzvah of Kriyas HaMegillah. The question is whether women can be motzi men, can read for men. So Rashi and Arachin and Daf Beis Amud Beis, amongst other Rishonim, says yes. But the Shita of the Bahag, as brought down by Tosfos in many places, including Megillah and Daf Daled, says no. The Bahag says a woman cannot be motzi. And the explanation that the Bahag gives is because really there are two different types of mitzvahs. The mitzvah by men is to read the Megillah and listen. By women, it's just to listen. It's not to read. So if a woman's chiyuv is just to listen, she can't be motzi men whose chiyuv is to read. That's the basic idea of the Bahag. And as the Rishonim and the Shulchan Aruch is choshesh for that idea. So that's, again, important, A, because if you're in a hospital and let's say there was, one of the doctors were women and one was a man, then the woman shouldn't read for the man. So if the woman is the only one who knows how to read it, so maybe, I don't know, read it together and both have a class so both can read it. But that's obviously somewhat. But perhaps a more important nafkamina is if you have a woman resident who also needs to read the Megillah for herself, the bracha, according to the Ramah here in Sif Beis, men make the bracha of al mikra Megillah because that's their mitzvah. But women, because we're choshesh for the Bahag, their bracha is different, and it should be lishmoa Megillah. Ideally, if they said al mikra Megillah, they would be fine. But they should ideally say lishmoa Megillah. It's a different bracha. So now, again, the question I was talking about that someone asked me yesterday with their chaplain, so it was a woman who asked me. So I told her if she ends up having to read, she should just try to make sure to make this bracha of the Shema Megillah if she's reading for herself. The other thing that's important that comes out of this Shulchan Aruch, it really stems from Yerushalmi at the beginning of the fourth parak of Megillah, is that one of the things on the list that the Mechaber writes is if a cheresh reads for you, you are not yotzei. Says the Mishnah Berurah Sifkat Hainu hamedaber ve'eno shomea klal. The cheresh that we're talking about is someone who can speak and not hear, meaning what we would call nowadays just someone deaf. Back then, very often, back in the times of the Gemara, if you were deaf, you also were mute because they didn't know how to teach them really until Helen Keller came along. But we're talking about oftentimes Chazal will use the word cheresh for both someone who can't speak and hear, and that type of person has significantly less das, as we call it. But here we're just talking about someone who can't hear, but they can speak fine. So what's unique here, and Rav Soloveitchik pointed this out, is that in general, someone who's able to speak and not hear, they're chayiv in mitzvos. So it's something interesting that we're saying someone who's chayiv in mitzvos still shouldn't read for you. And the question is, why not? What's unique about this mitzvah? And what you see from here is that something unique about the mitzvah is that the mitzvah of Megillah is not simply, even though the main part is to al-mikra Megillah, to say it, but part of that mitzvah is also lishmoa, to hear it. And you have to have the ability to hear it. Now, that has a lot of important nafkaminas. If you look at the Nishmas Avram here in Siman Tafresh Beites, he brings down a whole list of poskim and achronim that discuss the hearing aids and cochlear implants and microphones and all these different things, which are very, very important. But just what's specifically nogea to clinicians in a hospital setting. So if you look at the end of this Mishnah Berurah Sif Katanei, he writes, Vida, Demisha Kavdo Aznavo Shurachok Min Abima, someone who's hard of hearing. He's far from the bima and he can't hear well. So he should be very careful to at least read from a kosher Megillah, or at least the words that he misses, he can read in the Megillah, in a Chumash, as long as it's not the whole Megillah, obviously. So practically, that means that it's important, you have to be able to hear the Megillah. Now, what's considered hearing? Is hearing, as we said, is hearing with, a microphone, is hearing with a loudspeaker, hearing with cochlear implants. Hearing aids, these are all very, very important. Dinim, again, you can look in the Nishmas Avram, who discusses that at length. But the question is going to be a telephone, right? If can you go on your phone and listen into a minyan? If you can't, you don't have a kosher Megillah, you don't know how to read, even if you did have a kosher Megillah, you just want to you don't feel comfortable, whatever it is, can you do that? So most of the poskim assume not. Shlomo Zalman has an important tshuva in his Tshuvas Minchas Shlomo and Chelik Aleph and Siman Tes about this. But as he quotes the Chazon Ish, and what's known to a lot of people, Rav Moshe and Or Chaim and Chelik Beis and Siman Kuf Ches also has a tshuva amongst other places where he says midin, even though he doesn't encourage this, but there are times that through a phone you would be able to be yotze your mitzvah midina. So generally speaking, we do not. However, b'shas adchak, often we can rely on that. Rav Shachter has written in a tshuva that, for example, during COVID, when people weren't able to gather to get minyan and were afraid to leave their homes for health reasons, so b'shas adchak, when there was no other option, he allowed to call in and to rely on this Rav Moshe. Again, that would just be b'shas adchak, but that's another important aspect that's at play here. Again, if you can't gather minyan, you can't read it by yourself because either you don't have a kosher Megillah or you just don't know how, or the seirug and the spurts are going to be too long and you're in a place of an onus that you can't have too long spurts in between. So then perhaps you can call in and listen to a minyan that's laning already, or someone else that's laning for you already, with their brachos. Okay, so that's in short all things that have to do with Megillah. So now let's go to Mishloach Manos. So what does a doctor do, a nurse do, a healthcare, as I call them, healthcare hero do when they're in the hospital for Purim and they don't know what to do about Mishloach Manos? They're all going to be there all day. So just to begin, it's important to know that the machlokes, a very well-known machlokes by Mishloach Manos, what the purpose, what's the reason behind Mishloach Manos. The Trumas Hadeshin in Siman Kuf Yod Aleph tells us the reason is to give people enough for their Seudah. It's to give food for the Seudah. The Manos Halevi, which was written by the great Kabbalist, or Shlomo Alkabetz, the author of the Lichadodi. So in his Sefer on Esther, so he writes the reason is to be Marbe Shalom V'Reyos, to increase love, brotherliness, togetherness, unity, friendliness, peace, all that, to increase that's really the point of, for various reasons, as he writes there in his parish, but that's the reason of Mishloach Manos. So the Chassam Sofer famously discusses this at length in Tshuva and Siman Kuf Tzadi Vav and all the different nafkaminos. So we're going to discuss a few different options that a clinician will have in a hospital. Most of them will probably fall into this machlokas as to what we do, but they're just important things to think about. So firstly, it's just important to know the Mishnah Berurah and Siman Tafresh Tzadi Hey and Tzivkat and Yudches I put here in the slides writes that there's a suffix that the Binyan Tzion, Rav Yaakov Edlinger, the great Aruch Laner, there's a suffix that he had whether you whether you need to give Mishloach Manos through a messenger, through a shliach, or you can just do it yourself. Because the pasuk says Mishloach, that he sends, so it sounds like through a messenger. Now we all give by ourselves. We're not necessarily machmir, as the poskim say, to give with a shliach, but it's very obvious that you are allowed to appoint a shliach. So if a clinician had no other way, he can appoint, whether it's a spouse or the rabbi of a shul or anyone he wants, to give Mishloach Manos for him, that wouldn't be any issue. Now, what about if someone wants to give Mishloach Manos before Purim? So obviously I can't give today for Purim. That's not called Mishloach Manos. But what happens, as the Ber Heitev writes us in Siman Tafresh Tzadi and Tzivkat and Zayin, again, it's on the slides, so he gives his Mishloach Manos, but before Purim. Kodam Purim. Uve Purim atzmo bevadai magiyim liyado. But on Purim itself, that's when the person's going to receive the Mishloach Manos. Is he Yotzei or not? And he brings down from the Yad Aharon that Daita noted the Yotzei Yidei Chovaso, that he would be able to be Yotzei. So theoretically, if you arrange, there are many Jewish institutions that do this, beforehand arrange that Mishloach Manos will be given out on Purim itself to two people, two items, to two people at the very least, so you'd be able to be Yotzei your mitzvah, and that well as well, without a problem. The Aruch HaShulchan, he writes, that's point number 2. Point number 3. No, we're going to skip that Aruch HaShulchan. Point number 3. There's a big discussion whether one is allowed to give Mishloach Manos to sick patients if the sick patients can't eat the Mishloach Manos that you're giving them. So the Nishmas Avram actually brings down, I brought down from Ephraim Greenblatt in the Rivos Ephraim and Orachaim in Chelik Aleph and Siman Taf Nun Tes, who asks the question. But if you look in the Nishmas Avram, again in Siman Taf Rish Tzadi, he quotes a big machlokas between his Rebbe, Rav Neubert, and he ends up agreeing with Rav Neubert, versus Rav Zilberstein and Shlomo Zalman Auerbach. And he says that according to Rav Neubert, his Rebbe, you wouldn't be Yotzei if you gave, candy to a diabetic in the hospital. You can't be Yotzei your mitzvah. or anything else if the doctors say he can't really eat anything at this point or digest anything, whatever it is. But Rav Shlomo Zalman and Rav Zilberstein thought that you would be able to. Again, ideally, we wouldn't do this. You would have other ways. Either you would appoint a shliach, or you would just give it, make sure it's done on Purim beforehand. But this is a machlokas. If you forgot to do all of those things and there's no shliach to be appointed, there is a machlokas here. Rav Shechter has told me that he didn't say you wouldn't be yotzei your mitzvah, but he didn't think you should do this. But that this is an option that some of the poskim do think you could be yotzei your mitzvah mishlach manos with. That's that. Then I put here in the Aruch HaShulchan Nesimitav Reish Tzadi Vav and Sif Gimel. It's just an important thing to understand for doctors or in the hospital. That Yira Eli Dilatzeis Laderech Mi Beiso BePurim. Someone who's going to leave their house on Purim, Eino Nachon. He really shouldn't. The Iker Simcha Hu Bnei Beiso. The Iker Simcha is with his house, with his family. Kidachsiv Samachta Ato Veisecha B'Maser Sheni. Uveregalim Ksiv Samachta V'Incha Vitecha. So he should really be with his house. Mitzvah lios purim bebeso, skipping a few words. That's the mitzvah to be in his house. Imishto v'zara, with his wife and children. V'gam hanosem b'derech v'mucharach lamod be'ezeh makom l'kriyas Megillah. Even if someone is forced to travel, i.e., someone's forced to be in the hospital, and he's forced to listen to Megillah somewhere not in his house. Yeira lamod gam ezeh shos l'kaim sudas purim. He should set aside some time to have a suda. U'mishlach manos u'matanos lavyonim. Ve'eno ma'al masha beso nosnim b'shvilo. It doesn't work if you don't appoint your household member as a shliach. It doesn't work that just because you live with them that they give mishlach manos for you, says the Aruch HaShulchan. No, you're supposed to do it yourself. So ideally, you do it yourself, or you appoint someone to do it for you. But you can't just say, "Oh no, I'm relying. My wife's going to do it for me. My husband's going to do it for me." No, you're really supposed to do it yourself. And that's an important point of this. The last of the options here is the Ran in Zayin Amud Beis, based off the Gemara in Zayin Amud Beis, discusses the concept of Mechalfe Sud Asayo, that you can be Mekayim Mishlach Manos by exchanging meals. So if you're in the hospital, you can just go to the calf with someone else and you can exchange meals and you can both have the Suda and the calf. You buy that person's meal, they buy your meal. You're Mekayim Mishlach Manos and you're able to have a Suda on Purim, both would work. So those are all different points, again, disparate, but points of options and different things you can do in terms of Mishlach Manos. In terms of Matanos Lavyonim, so again, a person's supposed to give Matanos Lavyonim on Purim itself. As we just pointed out, the Aruch HaShulchan said, just because you're someone else, you can't assume, your household's going to give Matanos Lavyonim. That doesn't work. You have to give it yourself. And the Aruch HaShulchan writes in Tafresh Tzadi Dalid, in Siv Beis, I put on the slides, and the second line, again, you can appoint a shliach. So if you know you're going to be in the hospital today, find an organization, there are hundreds of them, that say we're going to make sure it's trustworthy, but say we're going to give out matanos avyonim on Purim. You can give them, your whatever amount of money beforehand, and they say we're going to give it on Purim. You're mekayim your mitzvah that way. That's the most ideal way of dealing with this. What about a Seuda? So again, we've dealt with mostly Megillah. I'm going to get back to that at the end. But Megillah, Mishlach Manos, Matanos Avyonim. The last thing we have is the Seuda. That's the other mitzvah that we do in Purim. So what do you do for a Seuda? So again, as I mentioned before, ideally go to the calf and have a Seuda. What do you need to eat for the Seuda? So there's a machlokus in the poskim whether one is supposed to have bread. The Magen Avram and Simon Tafresh Tzadi Ein Sivkat and Tess said that no one ever heard of you need to eat bread on Purim. Where did that come from? But the Aruch HaShulchan and Tafresh Tzadi and Siv Zayin writes, no. That you wouldn't be yotze if you didn't eat bread. Dum yid Shabbos v'yantif, similar to Shabbos and Yantif. V'odein mishtab lo lechem. And there's no meal without bread. So you need bread according to the Aruch HaShulchan. So that would be machlokes. Ideally, we try to have bread at our meal. So if you go to the calf, try to get a sandwich or at least something you can wash on. Now, we all know that part of the mitzvah of Purim is, as the Shulchan Aruch writes, based off the Gemara, Tafresh Tzadi and Sev Beis, Chai v'nish l'psume b'puraya ad lo yada, that there's a chiyuv to drink wine. Now, whatever the chiyuv is, as the Ramah says, it's not so much to get drunk, but to drink a little bit and then fall asleep. All the different things which I'm sure everyone's heard shiurim on in the past. Obviously, there would be an issur to get drunk in the hospital. That's very clear. You're putting lives at risk. And perhaps even drinking a little bit would be a problem, even taking a sip of wine. it may also be an issue. One would have to figure out in their situation if taking a little bit would even be appropriate, if that does anything. If they take a tiny sip of wine and then take a break while they're in the call room for half hour, maybe that would potentially work. I'm not saying I recommend it, but that potentially would work. And if you don't do it, you don't do it. It's not ma'akev, as the poskim all say. If there's nothing to do, there's nothing at all to do. The background to all of these mitzvos is that when you're a clinician in the hospital, very often you're already being an osek in a mitzvah. And when you're being osek b'mitzvah, you're pater min mitzvos, so you're pater from a lot of mitzvos, all of these mitzvos potentially. You're an ones for all of these mitzvos. But there are times when we still try to, if you can, if you have time here and time there, you should try to do it. But if a person is literally busy the whole time, there's nothing to do. He's being osek b'mitzvah, he's pater from all the mitzvos hayom. If you have breaks here and there, so you should try to get in Megillah, ideally. That's first and foremost. And then you should try to get in the other things. You should try to have a suda. You should do Mishlach Manos, Matanos Avyonim. Again, Mishlach Manos and Matanos Avyonim, you have the ability to do beforehand. So that shouldn't be really an issue. It's really the Megillah and the Suda, practically, that you can't do anything beforehand. Meaning beforehand, that should be done on the day. But Suda and Megillah, you can't do beforehand. So you should, again, Megillah is the thing you have to work on first. Make sure you get that. And the Suda also, you should try to be able to have some form of Suda. One of the things I mentioned, just to go back to the Kriyas HaMegillah before we end, is another question I get a lot is the Zmanim, is about, if you're going to shift or whatever, what time can you read the Megillah? So at nighttime is a discussion, but really we hold that you're not supposed to read before Tzeias HaKochavim. The opinion of the Gaon and other Achronim, the Vilna Gaon and the other Achronim, is that reading the Megillah during Bein HaShmashos, right, going into Purim, doesn't work. You need to wait till Tzeias. Now, the Mishnah Berurah does point out in Sifkat and Yudal and in Tafresh Sadi Beis that b'shas adchak maybe you could listen to the Megillah in Bein HaShmashos. So there are many poskim that say that's the only option. There's no option to do anything else. So you have what to rely on because of that Mishnah Berurah. But ideally, we really wait until Tzeias HaKochavim during the day. So again, we read from Netzach Chama on all days the mitzvah. If you're in the Mishnah Berurah writes in Tafresh Pezayin Sifkat and Vav, if there's any reason, any ones, even a slight ones, the Mishnah Berurah says, it doesn't have to be so major, so you can read already from Alos, from before Netzach Chama. So if you know you're going into the hospital early, and you know you're going before Nate, but you can still get a Kriyas Megillah after Alos, so that wouldn't be a problem at all. The only question would really be if the Megillah can only be heard Bein HaShmashos. That would be a question that one would need to ask. So again, just to quickly summarize what we did very, very quickly, I apologize, but I didn't want to take too long with these things. But we discussed Kriyas HaMegillah. We pointed out that Kriyas HaMegillah really ideally should be done b'tzibor, with other people, with many other people, with at least 10 other people, but we allow biyachid. You would be able to say the bracha alone, the brachos beforehand, even if you're reading alone with a kosher Megillah, but you would not say the brachos afterwards. That's the ideal situation. Again, if you had an option where you had spurts, so if the reason why you had to leave the Kriya and you had to go back to a patient, if that is called an ones, so maybe you would have to go back to the beginning, maybe you wouldn't. It depends on, again, your given situation. Number 3, if you're a woman that's in the position, you should try to make a different bracha beforehand if you're doing this. Lishmoa, not al mikra Megillah. Number 4, if none of these options work, so b'shas adchak gadol, we can rely on Rabbi Moshe Feinstein and call into a Megillah to hear the Megillah. The zmanim are what I just pointed out. In terms of Mishlach Manos, so again, ideally appoint a shliach to do it, or you do it beforehand and set it up so that it's given on Purim itself. If those options don't work, giving to a chole who can't eat it is not ideal, but there are poskim that allow it. And giving to I didn't mention this also, but our Chashulchan discusses giving to a katan. There are other potential options, but you should try to do it yourself. Matanos Avyonim, again, set up beforehand that it's given on Purim itself. That also won't be an issue. And the Seuda, so again, ideally have bread. It's a machlokes. If you don't, you could still be yotze your mitzvah of Seudas Purim probably, but ideally you should have bread. And in terms of obviously, and ideally have fleishichs, I didn't mention, but that's what our Chashulchan there also said. And in terms of drinking, obviously, it's usher to get drunk if you're in hospital. If there's a way to drink a tiny amount of wine and it doesn't affect you, and you can take a short nap to fulfill the words of the Ramah there. So maybe one has to figure out what their situation is, but maybe that would work as well. Again, for the Suda, also switching meals with someone else, buying meals for someone else. that would also be an option. Okay, so there are a lot of different options that are laid out before everyone. And everyone should ask their local rabbi, their rabbi, what the most ideal one is, what the best one is in their given situation. Okay, I think that's pretty much covers most of the stuff. That's
Thank
okay.
you so very much. I guess if there's any questions, now would be the time to ask. Okay, so I guess we'll cut it there. Thank you so very much, Rabbi Steinmetz, for that very in-depth share. And hopefully that's a good springing point for people to go and ask the questions that they need to ask.
Be'erat Hashem, everyone should have a good Purim, a Purim just of Simcha, and we should have continued Simcha from all of Klal Yisrael.
Amen.
Thank you.